So now I'll just talk about some of our main findings related to our first research question. So what is the impact of COVID-19 on the child, caregiver, and family? Okay, so this graph looks at the impact of the pandemic specifically on the child only. So looking at the child's behavioral problems, the impact on their child's daily routine, the child's fears and anxiety levels, their sensory difficulties, and their sleep quality. So these colored bars here indicate how many participants selected each response category, which you can see in the legend on the right. And the numbers inside of each of these colored bars indicate how many caregivers selected each of these different categories. So for example, 33 parents indicated that their child's behavioral problems slightly worsened or were slightly disrupted. So this yellow kind of color corresponds to this response category. So the yellow and orange colors indicate some degree of disruption, whereas the bluish colors on the left indicate improvements in each of these different outcomes. And the gray bars in the middle represent the number of participants that indicated that there was neither a positive nor negative impact on each of these different outcomes related to the child. So they were neutral, or there was no change in each of these different areas. So as you can see, looking at this graph, the majority of participants lie on the right side of this graph, if the middle is this neutral or gray category. So this shows that there are far more orange or yellow colored bars than bluish bars, indicating that the majority of caregivers observe a disruption in their child's behaviors, their child's daily routine, anxiety levels, sensory difficulties, and sleep quality. When you look specifically at the different outcomes that were measured, so these outcomes here, out of all of these, the most negative impact of the pandemic has been on the child's daily routine, as well as their child's fear and anxiety levels. So it was really hard to read when going through the comments. Some parents mentioned that their child didn't understand why they weren't allowed to see certain families or their peers at school, or why they had to wear masks all the time and things like that. Other parents commented on having lost gains that their child had recently made in school or at home. But looking at this graph, you could also see variability. So looking at these families in the blue here, so there were caregivers that reported that their child was showing improvements in each of these different areas. Some parents commented that the social demands have decreased ever since the pandemic started. So their child was coping better, not having to deal with busy school schedules and things like that. So now this figure here is illustrating the impact of COVID-19 on the caregiver. So looking at caregiver anxiety, family relationships, the relationships with their spouse, and the caregiver sleep quality. So again, we see a similar pattern where the majority of responses are concentrated here on the right of these gray or neutral bars. So there are larger yellow, orange bars compared to bluish bars, indicating that the majority of parents are reporting a slight to extreme disruption in each of these different areas. So their anxiety levels, their relationships with other family members, their relationships with their spouse, and their sleep quality. So overall, we see a pattern of disruption or negative impact of the pandemic on outcomes related not just to the child, but also the caregivers. And again, it's interesting to see that despite the negative impact that we would anticipate from COVID-19, there are families again and caregivers that note improvement. So these families indicated by the blue color here. So the second half of this presentation will take a closer look at these families that appear to be doing well and demonstrating resilience despite current circumstances and the challenges posed by the pandemic. And we'll look at what they're doing well and their coping abilities. So in our survey, parents were also asked if they ever considered putting their child into the care of the Ministry of Children and Family Development during the pandemic. So this was a yes or no question. And giving up one's child to the ministry is seen as a last resort. So when parents are facing a crisis and they're unable to care for their children in their own home, this is an option. So one parent commented on the survey, "I have been close to relinquishing guardianship to just keep what's left of my family together." So almost 10% answered yes to this question of giving their child up into care. We were also interested in safety issues in these households. So when asked whether or not they were worried that their child would physically hurt another family member, approximately 37% of caregivers said yes to this question. We didn't specifically ask parents about the child's own self-harm behaviors. So I was pretty shocked when reading again through the open-ended responses. A substantial number of parents talked about this unprompted. They talked about their child's self-harm and self-injury behaviors and how these have increased during the pandemic. Yeah, so we had one parent say, "I'm considering entering into a special needs care agreement or relinquishing partial custody so I can manage the safety issues that have arisen during the lockdown." So similar to what the previous parent said, but specifically highlighting these safety issues. We were interested in examining the relationship between caregiver and child anxiety to see if they were related. And this is exactly what we found. So the results here show a positive relationship between caregiver anxiety and child anxiety. So there's a positive relationship indicating that as the caregiver's anxiety symptoms increase, so do the child's anxiety symptoms. The child's anxiety symptoms also increase as well. Because this is a correlational relationship, this means that there is a strong likelihood that they are related. So it was found to be significant, this relationship, but it doesn't tell us the direction of this relationship. So we don't know if caregiver anxiety is causing child anxiety or if it is the other way around. So what is the significance of this finding? So the implications are that if we assume the relationship is in the direction of caregiver to child, then targeting caregiver anxiety may help improve the child's mental health outcomes. And there is some evidence of this in the literature. So interventions that target parent mental health by promoting effective coping skills, stress management, and emphasizing emotional well-being. These interventions and programs have been shown to have a spillover effect on other family members, including the child. And now looking at this graph here, so we wanted to see how the pandemic impacted families' income levels. So on the x-axis here, you can see the different categories of financial impact. So not at all means that there was no impact on the family's income. Slightly, this category here indicates a decrease in their income by less than 20%. Moderately indicates a decrease in their income between 20 and 40%. And severely, this category here indicates a decrease in their family's income by more than 40%. And on the y-axis are the number of families or caregivers that fall into each of these different categories. So there are 74 caregivers that indicated that the pandemic had no impact on their family's income. Here we see 52 caregivers report a slight decrease. 55 caregivers reported a moderate decrease in their income, and 41 caregivers indicated a severe decrease in their income. So if you combine all of these three categories here, you can see that the majority of families, so 67% of families, report some loss of income compared to this category here, families that fell into this category where there was no change. And we'll talk about later how family income might be related to family quality of life. So in summary, during the pandemic, families report negative outcomes during the lockdown period. We found a relationship between child and caregiver anxiety. Our survey revealed that almost 10% of caregivers considered putting their child into care. We also found that 37% of caregivers were worried that their child would physically hurt another family member. And 67% of families report a slight to severe impact on their family's income.